Hi, this is Dr. Kevin Smith, and this is how to get lasting relief from chronic knee pain without drugs or surgery. This is for anybody that has chronic knee pain, or if you have joint stiffness, or if you're experiencing crunching and popping noises, if walking or extended standing is particularly painful, or you're having pain going up or down the stairs, and even if you've been diagnosed with bone on bone. Knee pain can inhibit people from doing the things that they love to do, such as gardening, or getting on the ground to play with their grandkids, or hitting a round of golf, or maybe playing some tennis, or taking that dream vacation because it involves a lot of walking that can be very, very difficult for people suffering with painful degenerative knee pain. So let me ask you a question. What has your pain cost you, and what limitations has this problem placed on your life? For some people, there's a dollar figure that they can assign to this, and that dollar figure can involve things like cortisone injections, or visits to the physical therapist, or visits to the chiropractor, or maybe surgeries or knee braces, or all kinds of things. And that can add up to thousands and thousands of dollars. But there's also another way of looking at this about what your pain has cost you in terms of what can't you do. For some people, they can't enjoy themselves. They can't go on vacation. They can't tolerate being in a car for a long time. Going up and down the stairs is miserable. Maybe they've had to take on a stair lift or move to a new location that didn't have any stairs. They have to park their car close to the entrance or the exit of a venue so that they don't have to walk a lot. I want you to think about what your pain has cost you and take a look at that. So if you're going to pay attention to anything in this video tutorial, I want you to pay attention to this slide. This is the big picture of knee pain. Altered neurological control can lead to abnormal movement patterns, which can lead to chronic inflammation and pain. Everything starts with altered neurological control, and then that leads to abnormal movement patterns, and then after a while, that leads to wear and tear, chronic inflammation, and pain. So let's take a look at the nervous system. The nervous system is composed of the central nervous system and the peripheral nervous system. The central nervous system is the brain and the spinal cord, and the peripheral nervous system are the nerves that go up and down the legs or the arms. The lumbar spine are the 5 vertebrae that is around your low back, and that includes the L1 through 5, and then the spinal nerves come out in between the vertebrae. These spinal nerves and the lumbar spine end up going down the leg to control the knee and everything else around the knee. Inside each of those peripheral nerves, there are 9 internal fibers. 2 of those fibers send pain signals up to the brain. 4 of those fibers controls the muscles, 2 of those fibers controls the blood vessels, and 1 fiber controls balance and touch. How much pressure do you think that it can take to decrease nerve function by as much as 60%? The answer is 25 millimeters of mercury of pressure, which is the weight of a quarter. That's all it takes, is the weight of a quarter to decrease the nerve function by as much as 60%. These are pictures of 2 vertebrae. The one on your left is what normal looks like. This is a bird's eye view. And in the center you have the spinal cord, and then branching from the spinal cord are the spinal nerves, like branches of the tree. The spinal cord is the trunk of the tree, and the spinal nerves are the branches of the tree. On the right, it shows what happens with spinal stenosis. The middle section, the cord is getting crushed, as are the spinal nerves. There's pressure on them. And when that happens, that can cause things like sciatica, it can cause peripheral neuropathy, and it can most certainly cause a disruption to the function of the knees. A lot of people are not really paying attention to the fact that your knees are controlled by the nerves, and if you have a stenosis in the lumbar spine, that can affect the neurology going up and down the leg. Abnormal nerve function can cause things like weakness, cramping, restricted ranges of motion or stiffness, restless leg syndrome, balance problems, cold feet, and abnormal movement. Can you relate to any of these? What drugs do you have to take to fix abnormal neurological function? The answer is that drug does not exist. Drugs do not fix abnormal neurological function. Your knee is a modified hinge joint. It does flexion and extension. And the knee motion is very much like a hinge that rocks back and forth. The knee joint is composed of two bones, the femur and the tibia. The two other bones, the patella and the fibula, are not actually part of the knee joint proper, but they are for the attachment of accessory muscles. Normal knee movement is controlled by 12 muscles. You have 6 muscles in the front that control extension, or when you straighten your leg, and you have 6 muscles in the back of the leg, the back of the knee, that control flexion, or when you bend your leg. This normal motion is controlled by an organized concert of movement. It's a balancing act between the muscles in the front of the leg and the muscles on the back of the leg. And every single one of those muscles has to be healthy, and it has to pull with a certain amount of force to assure that you have smooth gliding motion. Your body learns patterns of movement over time, which are good or bad. What is going to happen to your knee if your body only knows abnormal movement patterns? Has anybody here ever had this happen to them, where you have a tire that goes bald? Not only does it go bald, but it's wearing more on one side than on the other side. Let me ask you a question. Would changing the tire fix the underlying root cause of the problem? Yes or no? The answer is no, it probably wouldn't. That you can put a new tire on it, but in time, that new tire is going to go bald with probably the same wear pattern as this one. The reason that the tire goes bald is because you have an abnormal alignment. The same thing with your knee. You have wear and tear, chronic pain, and inflammation because of abnormal movement patterns on the knee joint, which were caused ultimately by abnormal neurological control. What drugs do you think can fix abnormal movement patterns? The answer is it doesn't exist. There are no drugs out there. Chronic knee inflammation can involve things like arthritis, tendonitis, and bursitis. Anything that ends in an itis means inflammation. So arthritis is inflammation of the joints, tendonitis is inflammation of the tendons, and bursitis is inflammation of the bursa. That's also involved with wear and tear of the joint and chronic pain. Pills and injections are the most common therapy for treating inflammation and knee pain. But let me ask you this question. Why do you think that medications fail to provide a permanent solution to knee pain? The answer is that they're only masking the symptoms. They're not actually fixing much of anything. And that also includes cortisone. If you want permanent relief of chronic knee issues, we have to restore neurological control, then we have to reset the normal motion, and we have to resolve the chronic pain and the inflammation that's built up inside the knee joint. To restore neurological control, We use a therapy called Neuromed. Neuromed is a high-tech device that resets the neurological control as they feed into the muscles. This is not the same thing as an interferential machine, such as what's used in physical therapy. This is a very, very high-tech device. To reset normal motion, we use a therapy called Trigenics. Trigenics is a neurological therapy that resets the way that the brain communicates with the muscles in the knee. It gives you better range of motion and dramatically decreases pain very, very quickly. To resolve pain and inflammation, we use a very powerful cold laser. When the laser energy reaches the target tissue, two things happen. It can resolve pain and inflammation, and it can also accelerate and heal damaged tissues. So your next simple steps are to reserve your spot, pick a time that we can agree upon, get a consultation, an examination, a report of findings of what we found during the exam, and my professional recommendations. We need to do a comprehensive examination to evaluate you for neurological function. We need to do some orthopedic tests, and we need to check your muscles to see how they're functioning. When you come in for your consultation, it is strongly recommended that you bring the person closest to you. If you're married, the logical choice would be to bring your spouse, somebody that can help you to make financial and healthcare decisions. If you're not married, it's okay. We would recommend that you bring somebody with you, and if you can't, that's okay too. After the exam is done, we generate a report for you detailing the results of your examination. We will let you know if we can accept your case, and if we can, we'll give you our best recommendations that will help you to achieve your goals. In addition, you will receive 2 trial treatments if you qualify. The regular price for the comprehensive knee workup is $165. But when you schedule today, because you had a chance to watch this webinar, you can have a consultation for $65. This is a safe investment. If you decide to do care in our office, we will take your $65 investment and apply it toward your treatment plan, which means that you really have nothing to lose but the pain. So who should come see us? Anybody that has chronic knee pain or joint stiffness, popping and crunching noises, pain going up and down the stairs, difficulty with walking or standing. If you don't want more drugs and you definitely don't want surgery and you want to be able to do more and more, you should definitely do a consultation to see what we can do to help you. Who should not come in for an evaluation? Please don't come see us if you're not that serious about getting better. How do you know what your seriousness level is? Well, on a scale of 1 to 10, where 1 is that you're not serious at all, and 10 is you're ready to rock and roll to put this problem behind you, I'd like you to be at least a 7 out of 10. If you're not a 7 out of 10, please do not make an appointment, because we really won't only want people that are serious about getting better. If $65 is actually a stretch in your budget, what that tells me is that you're probably not taking this that seriously. $65, you can't even go out to dinner at a decent restaurant for $65. But I understand that a lot of people are cost conscious. I am too. And there are 2 questions that typically people have at this point. Number 1 is, how much of this is covered by insurance? And number 2 is, what does the program actually cost? Let me answer that for you. The first question is this covered? How much of this is covered by my insurance? The answer is, it is not covered by insurance at all. This is considered not to be the standard of care, which involves drugs and surgery. That's typically what the insurance pays for. Even though I am a doctor of chiropractic, this is not chiropractic care. I always get that one person that says that they get 12 visits per year if they go see a chiropractor. That's for chiropractic services. Remember, Trigenics, Neuromed, and laser is not considered to be chiropractic care. It is not a covered service. Number two is how much does the program actually cost? The answer to that is I have no idea. I don't know if I can even accept your case, and I don't know what's wrong with you. I haven't even had a chance to do a consultation. So my recommendation is do the consultation and find out if I can help you first, and then we can talk about specifics. This is Medicare Guidelines, Section 2251.3. A treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent the deterioration of a chronic condition is deemed not medically necessary. What that means is that Medicare will pay for you to suppress your symptoms with drugs and for you to have surgery, but they're not going to do anything to enhance your quality of life or to prevent disease or to prevent a deterioration of a chronic condition. Ultimately, it is your responsibility. That being said, this is affordable care. Our typical patient is a 78-year-old widower living on a fixed income. We also offer guaranteed results. We guarantee results within 2 visits, or we won't accept your case. Knee problems are a progressive, degenerative issue. Wherever that you are right now, in time, it's going to get worse unless you do something about it. To set up a consultation, call my office and one of our team members will schedule your appointment. You pay your $65 fee for the consultation, and we will send you your new patient forms. I want you to fill out your paperwork at home prior to coming in for the consultation. And to fill out the patient paperwork will only take you about 20 minutes. Please arrive about 15 to 20 minutes prior to the start of your scheduled consultation. That way we can check you in at the front desk, we can review your medical history, and we can start your consultation on time. I want you to wear or bring with you shorts and a t-shirt because we're going to be doing some orthopedic tests and some neurological tests and moving you around. If you have any MRIs or x-rays or radiology reports from them, you can bring them with you and we will review them. Call 412-595-7332 to schedule. Again, that number is 412-595-7332. You get to decide what comes next. Where do you want to be in 2 or 5 years? Do you want to be sitting in a beach chair on a cruise ship, or do you want to be sitting in a wheelchair in a nursing home? That's the choice that you need to make. I thank you very much for watching this video. This is Dr. Kevin Smith. I look forward to meeting you and to helping you to achieve your health goals. Give me a call at 412-595-7332. Thank you very much.